Hundreds line up to voice their opinions about a proposed change in the rules for medical marijuana providers. The state is considering limiting caregivers to 5 patients.
That could impact dispensaries, which provide marijuana to hundreds of patients. CBS 4's Terry Jessup spent the day at the hearings. And Terry, the state's chief medical officer is pushing for this change.
Karen, he is leading the charge. Right now, an amendment to the state constitution allows designated caregivers to grow marijuana for an unlimited number of patients. The State Board of Health says that is creating confusion and opening the door for drug dealing fraud. But this hearing today attracted more than 350 people, with most of them saying leave the current system alone.
The State Board of Health argued if there's no limit to how many patients medical marijuana providers can supply, the program will continue to be abused and open to fraud.
We have law enforcement busts of large growing operations where the first claim, later rejected, was that they were only supplying medical marijuana.
But opponents of the proposed 5-patient limit, like this AIDS patient, say it will force them to look for drugs out on the streets.
I weigh 100 pounds. Imagine what happens if about 100 pounds of me goes on Colfax trying to look for medical marijuana.
There are now at least 30 medical marijuana dispensaries throughout the state, with anywhere from 7,000 to 9,000 registered users. Prosecutors and police testified if caregivers are not monitored by limiting their number of patients, their job enforcing drug laws is next to impossible.
And there's no way to appropriately protect that patient when they have a caregiver who's a caregiver of 300 other people. That's not caregiving, that's marijuana grows, that's distribution.
Police agencies say they're already seeing abuse in the form of people photocopying user registration forms. But medical marijuana advocates say the people spoke when they approved the system at the ballot box in 2000.
I don't think the government has any business in the doctor-patient relationship. I certainly don't think that these board members would be happy if they showed up to receive a prescription medication and were told, sorry, we've already helped 5 people. It really makes no sense.
This hearing is continuing as we speak. As I mentioned, they had about 350 people sign up to speak. So far, they've only heard from about 70 of them, so this could go on for several hours. We are given to presume that the State Board of Health will make a decision on this proposed new regulation later on this evening, but they could cut this off at any time. We'll have more for you coming up at 6 o'clock. We're live on the Auraria campus. Terry Jessup, CBS 4 News.
And it could be a long evening in store. Terry Jessup, thank you. Now, this board voted to limit the number of patients to 5 in 2004, but a judge threw out that limit because there wasn't a hearing on the issue at the time.